our focus on NDTV is India's worst health crisis. Amid all the data, we've touched a record global death toll. But what about the tragedy of each life which is lost in India's worst health crisis? Desperate Indians today around the country are begging, pleading and dying, waiting for beds, oxygen and medicines. Just look at these visuals from different parts of India, whether it's rush for tests, whether it's rush for beds, whether it's rush for oxygen. Indians are standing in line literally for a matter of life and death. Just to look at some of the stories from around the country which capture what's actually happening. From Uttar Pradesh's Varanasi, a young man lost his life literally at his mother's feet. His mother sitting in that auto rickshaw and e-rickshaw as her son lies sprawled, dying. She just cannot get admission in a hospital because they said they couldn't take him in. He was a kidney patient and apparently had COVID as well. He didn't have a test. They went from one hospital to another. Let's go across to Hyderabad, where the situation here is a son searching desperately for a hospital bed for his mother who's lying dying in the ambulance. The mother eventually died. The young man said he went to hospital, but nobody gave him a bed because she didn't have a COVID positive report.
क्या कैसे खत्म हुए?
ऑक्सीजन की कमी के कारण।
कब?
ये सुबह 7 बजे।
आप सिलेंडर भी लेके आई थी?
हाँ, सब लेके आए थे, लेकिन ये लोग चाबी नहीं दिए खोलने के लिए।
तो किसने बताया था आपको ऑक्सीजन कम हो रहा है?
मैं खुद स्टाफ हूँ सर।
In Madhya Pradesh, 10 patients have died after a hospital in Bhopal, the state's capital, ran short of oxygen. This deaths coming at the People's Hospital, ironically named on Monday. Families said their relatives died because oxygen supply dipped fatally. The government says there have been no deaths due to oxygen shortage, but listen to what the families are saying. However, the hospital says there was a dip in oxygen pressure for some time. And as well, the buck is passed, lives are lost. In Ahmednagar, Maharashtra, again a desperate plea from doctors saying that we don't have oxygen left in our hospitals. Patients are actually being shifted to Pune in the hope that they'll get an oxygen supply there. So imagine if you're a critically ill patient being shifted to another city because you don't have oxygen.
See, around about 80 to 85 patients are there for COVID, out of which around 80% are on oxygen, and of them around 25% on ventilator. So right now there is acute shortage of oxygen. Since last 3 to 4 days we are facing oxygen shortage, but somehow administration could manage this. But today there is acute crisis, and oxygen left is only for about 3 to 4 hours. If the situation is so grim, and if the administration is and the local vendors are not able to meet with the supply, not able to meet with the demand, then things will go out of control.